This podcast is about promotion on the clinician-teacher track and has been developed by Drs. Schrager and Sadowski in conjunction with the University of Wisconsin School of Medicine and Public Health Office of Faculty Development. There is no requirement to get promoted on the CT track, no time limit that one can be a clinical assistant professor. In some departments, there may be a monetary benefit to getting promoted, and it feels good to have one's accomplishments acknowledged, which is another reason to get promoted. In order to get promoted to clinical associate professor, you need to be in clinical practice for at least 5 years. Not all of these years need to be here at the University of Wisconsin. The emphasis of promotion for everyone on the clinician-teacher track is placed on clinical care. Evidence of excellence in clinical responsibilities, particularly patient care, should include at least 4 letters of support, at least 2 letters of evaluation from colleagues in the candidate's specialty, and 2 letters from referring physicians or physicians the candidate has referred to, in or outside of the candidate's specialty area. Letters should compare the quality of the candidate with other faculty of similar rank and experience. Patient letters may be helpful in supporting the promotion, but cannot substitute for these professional letters. Patient satisfaction data, quality data, and peer evaluations may also be used to support clinical excellence. The chair of the department will also provide confirmation of excellence in clinical responsibilities and patient care. Candidates may strengthen their application by providing evidence of significant accomplishment in a secondary area, but this is not required. You will need documentation to demonstrate that your contributions in this secondary area are above and beyond what is expected of all CT track faculty in your department. Many CT track faculty get promoted on clinical care alone without a secondary area. Possible secondary areas include 1. Medical education. Teaching at an appropriate level and in conjunction with clinical responsibilities is an important role for our clinical track faculty. The quality and quantity of teaching, as well as any administrative responsibilities for educational programs, should be documented. 2. Medical community service. For example, hospital and medical committees, volunteer and outreach services, community and allied health lectures or presentations, involvement in local, state, regional, or international medical and/or professional organizations. And 3rd, other types of service, such as administrative assignments or collaboration on clinical research. Promotion to clinical professor requires a minimum of 10 years in clinical practice and is predicated again on excellent patient care. Not all of these 10 years need to be at the University of Wisconsin. Emphasis and consideration of promotion to clinical professor will be placed, in most cases, on the candidate's accomplishments since the time of appointment at or promotion to clinical associate professor rank. Documentation must include evidence that the candidate has continued to grow in stature and to distinguish him or herself in their clinical service and in related activities. Documentation will follow the format required for promotion to clinical associate professor and include letters of evaluation.